Hey guys, Tony Maritato here. So I used to do something called the Medicare Minute. It was never a minute long. My hunch is this video is going to be 3 to 4 minutes. But with 2023 right around the corner, I want to start answering some common questions that come in related to PT, SOP, and private practice. So the resource I'm going to use to answer this question is from CMS Chapter 15, the Medicare Benefit Policy Manual. And this particular answer is to a question related to multiple plans of care. If you're like me, if you're working in outpatient PT, OT, SLP, you've probably had a patient referred with a specific condition. Maybe you've done the evaluation and now you get a second referral for the same patient, either from the same doc or a different doc, looking for a new condition to be added to the plan of care. What do? So on CMS Chapter 15, page 167, I'll put a link to this resource down below. I'm going to read the exact quote from Medicare and then we'll talk about it in a little case scenario. So this says, quote, two plans of care. It's acceptable to treat under two separate plans of care when different physicians or non-physician practitioners refer a patient for different conditions. It's also acceptable to combine the plans of care into one plan of care covering both conditions if one or the other referring physician is willing to certify the plan for both conditions. The treatment notes continue to require timed code treatment minutes and total treatment time in minutes and need not be separated by plan of care. Progress reports should be combined if it is possible to make clear that the goals for each plan are addressed. Separate progress reports referencing each plan of care may also be written at the discretion of the treating clinician or at the request of the certifying physician or non-physician practitioner, but shall not be required by the contractors. And when they say contractors in this document, they're talking about the Medicare contractors. So I'm in Ohio, my contractor is CGS. So let's talk about this for a second. There's a couple scenarios where this is going to come up. Let's use this example of two separate physicians referring the same patient for two separate conditions. A common thing that I might see in my clinic is I get a referral from a primary care physician for a patient with low back pain. Then 1 or 2 weeks later, that same patient arrives with a new referral for right knee pain. Maybe the referral for right knee pain is coming from an orthopedic who's planning on trying to avoid surgery. They want the patient to receive injections and do physical therapy. What I will typically do in a case like that is I'll combine the two plans of care. But what might happen is the surgeon might need the documentation from the physical therapy plan of care to support the injections that they want to do or support an MRI that they want to order for possible further surgery or investigation. So I'll combine my plans of care, usually under the primary care physician if they were the ones that referred first, but I'll send a copy, I'll CC to the orthopedic surgeon as long as I get a release, a medical release from the active patient. The only time that I'll typically do completely separate documentation, separate evaluations, separate medical records, separate daily treatment notes, progress reports, is when one of the two conditions is either related to a workers' comp case or a personal injury case. Because in those scenarios, I need that condition to be completely separate from any pre-existing condition that I might have been treating or any unrelated condition that I'm treating. So if it's not workers' comp, it's not personal injury, I'm almost always going to combine the two cases into a single plan of care. If I've already evaluated the patient for one condition and I need to evaluate a second condition that is a billable event, I will schedule that as an evaluation. I will do that evaluation. I'll add that diagnosis code to the billing record. I'll add specific long-term functional goals to the plan of care. But keep in mind that that second evaluation is a billable event under Medicare. And there's documentation within the Medicare record. In fact, in my next video, I'll address doing a second evaluation when a new condition arises after you've already done a first evaluation for a different condition, but you still have an open plan of care. Guys, I hope that answers your question. Page 167 for the original reference, and I'll post a link to that down below.